Body dysmorphic disorder, Jaden Mish and Sydney Smith. Body dysmorphic disorder is a chronic mental illness where the subject cannot stop thinking about a flaw with their appearance. The flaw is usually either minor or imagined, but to the subject, their appearance seems so shameful that they don't want to be seen by anyone. This disorder is sometimes called imagined ugliness. Patients that suffer with body dysmorphic disorder often show the following symptoms: a preoccupation with physical appearance, a strong belief that an abnormality or defect in appearance makes you ugly, a frequent examination of oneself in the mirror or an avoidance of mirrors altogether, belief that others think negatively of your appearance, the need to seek reassurance about one's appearance from others, frequent cosmetic procedures without satisfaction with the results, excessive grooming, extreme self-consciousness, refusal to appear in pictures, skin picking, comparison of oneself with that of others, avoidance of social situations, and the need to wear excessive makeup or clothing in an attempt to camouflage perceived flaws. Jill's symptoms included a preoccupation with her nose, lips, breasts, and hair, compulsive plucking at her acne all night, excessively looking at mirrors to check her appearance, which made holding down a job difficult, asking family members for reassurance about her appearance, and paranoia regarding others laughing at her because of her appearance. In order to be diagnosed with body dysmorphic disorder, you have to meet 3 diagnostic criteria. The first is having a preoccupation with an imagined defect in appearance. If a slight physical anomaly is present, the person's concern is markedly excessive. Our case study patient, Jill, picks at blemishes all night, combs her hair excessively, and thinks her nose is big and shiny, which shows that she meets that criteria. The second criteria that you have to meet in order to be diagnosed with body dysmorphic disorder is that the preoccupation the patient has will cause them clinically significant distress or impairment in social, occupational, or other important areas of functioning. Jill thinks about her defects nearly all day long. She won't leave her house and firmly believes that her neighbors are watching her with binoculars. That shows that she meets the second diagnostic criteria. There are many disorders that are similar to body dysmorphic disorder. A few include anorexia nervosa, obsessive compulsive disorder, and social phobia. Subjects suffering with anorexia nervosa, which is a disorder that is commonly confused with body dysmorphic disorder, will have a preoccupation limited to concerns about fatness. Jill did worry about her fatness, but her concerns were not limited to that. Patients who suffer from obsessive compulsive disorder have concerns that are not limited to their appearance. In Jill's case, she was only preoccupied with things solely regarding her appearance. Sufferers of social phobia are worried about being embarrassed. Was first described in 1886 by an Italian psychiatrist, Enrico Morselli. He initially called the disorder dysmorphobia. Morselli reported that patients experience sudden fears of deformity and painful desperation. Over the years, body dysmorphic disorder has attracted the attention of some of the most prominent figures in psychology. Sigmund Freud encountered the disorder while treating a patient in the late 1930s. Freud described his patient as being so preoccupied about his nose that he was unable to function outside of his obsessive thoughts. Despite its historical relevance, body dysmorphic disorder was only officially recognized as a member of the somatoform disorders in 1987. Although our understanding of body dysmorphic disorder has grown considerably since the early work of Morcelli and Freud, many aspects of the disorder remain relatively unknown and understudied. Body dysmorphic disorder is characterized by persistent and intrusive preoccupations with an imagined or slight defect in one's appearance. For someone with this disorder, the perceived flaw is significant and prominent, often causing severe emotional distress and difficulties in daily functioning. It most often develops in adolescents and teens, and research shows that it affects males and females almost equally. About 1% of the U.S. population has this disorder. The obsession can be based off of any part of the body, but most common features obsessed over include the nose, hair, skin, complexion, wrinkles, acne and blemishes, baldness, muscle size, and stomach. The obsession may change over time, moving from one imagined flaw to another. The subject may be so convinced about the perceived flaw that they become delusional, imagining things about their body that's not true, no matter how much anyone tries to convince them otherwise. Or uncertain. However, biological and environmental factors such as genetic predisposition, malfunctioning of serotonin in the brain, personality traits, and life experiences may contribute to its development. There is some evidence that suggests that brain chemical differences, such as naturally occurring brain chemicals called neurotransmitters, which are linked to mood, may play a role. It has also been suggested that people who have body dysmorphic disorder may have a structural brain differences where certain areas of the brain have not developed properly. There are studies that show body dysmorphic disorder is more common in people whose biological family members have the condition, which suggests that there may be a gene or genes associated with this disorder. One's environment, life experiences, and culture, if they involve negative experiences about body or self-image, may contribute to body dysmorphic disorder as well. Body dysmorphic disorder is rumored among most famous people. In a society like ours, one that's focused on appearances, it's quite common for those who are in the spotlight to suffer from a disorder like this. Many people who do have BDD choose to deal with it personally. Marilyn Monroe has been rumored to have suffered from body dysmorphic disorder, yet there's little physical evidence to prove that. Michael Jackson underwent 30 cosmetic procedures and is one of the most famous undiagnosed body dysmorphic disorder patients. Jocelyn Whittlestein completely changed her appearance to please her husband, and because of that, she is a highly studied possible body dysmorphic disorder case. The Broken Mirror is the first book that was written on body dysmorphic disorder. It was published in 2005 by Dr. Catherine A. Phillips. Her book explains how this disorder is relatively common in a world that is obsessed with appearances. She describes the 700 plus patients she has professionally evaluated and how when this disorder is left untreated, it can lead to psychiatric hospitalization and sometimes suicide. Includes cognitive behavioral therapy. This focuses on teaching you healthy behaviors such as being social and avoiding obsessive behaviors such as mirror checking. Therapy can help you learn about your condition and your feelings, mood, and behavior. Using the insights and knowledge you gain in psychotherapy, you can learn to stop negative thoughts and to see yourself in a more realistic and positive way. You can also learn healthy ways to handle urges such as mirror checking or skin picking. A therapist can talk to you about which type of therapy is right for you, regarding the number of sessions and length of your treatment. Medications. There are no medications specifically approved by the FDA to treat body dysmorphic disorder. However, psychiatric medications used to treat other conditions such as depression can be prescribed for body dysmorphic disorder off-label. It may take as long as 12 weeks for noticeable improvement in those symptoms. You may need to try 2 or more medications before finding one that works well for you and has the fewest side effects. And you may need to try other types of antidepressants or medications if the main choices aren't effective enough. In some cases, you may benefit from taking medications in addition to your primary antidepressant medication. For instance, your doctor may recommend that you take an antipsychotic medication in addition to an SSRI if you have delusions related to body dysmorphic disorder. Disorder is hospitalization. In some cases, body dysmorphic disorder is so severe that it will require psychiatric hospitalization. Psychiatric hospitalization is generally recommended only when the patient is not able to care for themselves, or when they are in immediate danger of harming themselves or someone else. Their options would include 24-hour inpatient care, partial or day hospitalization, or a residential treatment which would offer a supportive place to live. Cosmetic procedures are not suggested by doctors because they do not fix the perceived flaw. Cosmetic surgery, dentistry, or other approaches usually do not relieve the stress and shame of body dysmorphic disorder. They may not get the results that the patient hoped for, or they may simply begin obsessing about another aspect of their appearance and seek out more cosmetic procedures. They don't treat the underlying condition, they are only temporary fixes at best. That is often under-recognized. Due to its under-recognition, there aren't very many cases that have made it to the noteworthy status.